Hello everyone, my name is Dr. Peters and I welcome all of you to this live session about obesity, the changing trends about obesity management, and how even the government of India is now thinking that it's high time that we take obesity as a disease, which always was declared by the WHO, and what all action plans or action tips that we can take and how collectively we can make India a obesity-free India. Dear friends, as I already said, my name is Dr. Peters. I am an obesity or a bariatric surgeon, and I'm the senior director in the Department of Bariatric, Robotic, and Metabolic Surgery at Max Smart Super Specialty Saket. I've been doing obesity surgery or bariatric surgery for almost more than 2 decades now, and I've been helping patients to fight obesity for a long time. And along with me, I have a whole team, especially Dr. Beena, who is my bariatric nutritionist or dietitian who takes care of my patients post-operatively, Dr. Gautam, Dr. Atul, Dr. Shalabh, Dr. Saurabh, and collectively we all are here to support you to take the right decision, to learn a few things about obesity and how obesity is not just a simple, a cosmetic problem, but a larger health problem and how it is related to other associated comorbidities. So to begin with, I must tell everyone that obesity is not how you look, right? So obesity is not, I feel fat, I feel, I feel heavy. It's about feeling the disease. It's about knowing that obesity has been classified as a disease and is a precursor for many other associated diseases like type 2 diabetes, dyslipidemia, hypertension, migraine, headaches, cluster headaches, problems with your heart, coronary artery diseases, problems with your kidney, deep venous insufficiency, PCOD in ladies, infertility in males and females both, right? And so forth. So obesity is not just something that you look at, but obesity actually is deep-seated in your body because it's a disease and it attracts many more diseases. I've been treating patients with obesity for almost more than 2 decades now, and I have seen a changing trend. When I started my surgery, I would say about 80% of my patients were from abroad. They were from the US, from Europe, from Africa, from Australia, New Zealand, and so forth. Today, 80% of my patients are from India, which is a good thing in the sense that awareness about obesity, it has increased over the last 2 decades. Earlier, people used to come and ask, is there a surgery for obesity? Just because I look slightly fat, just because people body shame me, I should get a surgery done? But today, people are aware that obesity is a disease and it is linked to many other life-threatening conditions. Let's talk about obesity for some time, right? Let's talk, why do people get obese? And what is it at grassroots level that we can do? Now, first understand obesity is a multifactorial disease. It's not something you eat and you become fat. That's not true. It doesn't happen that way. So let's take a family of 4 parents and 2 siblings, right? Now they are in the same environment. They live in the same house. They eat almost similar type of food, but one of the kids is obese and one is not. So here, genetics may play a more important role. Number 1, that means certain types of genes will be expressed in individual differently. So we all have genes, right? We all have our inheritance from genes, but certain types of genes may have a different expression on different individuals. So that may appear differently in siblings. Number 2, we may live differently. The 2 kids that we're talking about, one could be very active socially, very active in terms of physical work and playing tennis, playing football, soccer, and the other could be just a couch potato. That means he would prefer sitting on the couch, he would prefer playing video games and wrong eating habits, right? So important part is first genetics, which plays extremely important role because I do see people who are eating rightfully sometimes, exercising sometimes, but still find it difficult to fight this weight. So their genetics plays an important role. The other important role is hormonal. That means your hormones are not acting, are not aligned with each other. so that sometimes you keep on storing more. So the feedback mechanism that the body has, for example, we have a hormone called leptin, which has a feedback mechanism to your brain, which says, okay, enough of that, we don't need to store more, right? Or in easier way, I can say it like it's a overhead water tank. We all have sensors. So as the water fills, the sensor says, okay, this is enough, no more water. Similarly, we have feedback mechanisms in our body wherein we tell, or the body tells the brain, we don't need more calories, we don't need to store more. And sometimes these feedback mechanisms don't work well. And thereby the body keeps on accumulating. So sometimes people do think that, it's me, I'm not very convinced with my work and I'm lazy. Or the parents may feel that the kids are lazy, the husband may feel that wife is lazy, or vice versa. But it may not always be, defined by laziness or eating habits. So number one, genetics. Number two, hormone. Number three is behavioral changes. How you live, how you eat, what all do you eat, your eating habits, your work habits, your other habits in terms of, for example, there could be a sibling, one will always take a staircase going to the fourth floor or the fifth floor, the other one will always take a lift, right? Both may say, we play games, yes, but one is playing indoor chess and the other is playing soccer. So, of course, they're playing games, but are they spending the same amount of calories? No, they're not. So, that is the third part. Then comes, very importantly, your eating habits and your physical work. Now, please understand that just by eating less and doing more physical work may not always give the expected results that we want. So one may go to the gym, one may work out, may start playing soccer, badminton, lawn tennis, and all the other sports wherein you do actually spend a lot of calories, but still not get the same amount of time. So it is important to understand that it is not always eating and exercising. It is also related to your hormonal imbalance, to your genetic play, behavioral factor, and other environmental factors. So, yes, some part of obesity can be linked to your just eating behavior, but largely it's a complex disease which is influenced by so many other factors that I just mentioned. Right? Now let's try to break down obesity and let's try to take several myths that revolve around obesity. Right? Now I don't remember anyone coming to my clinic and telling me, doctor, I eat a lot of food, that's the reason I'm obese. Never. I've never heard that, right? Most of my patients will come back to me and say, I don't eat. I don't know. I mean, I don't eat. But still, even if I breathe, I take a deep breath, I gain weight. And I always smile to them and I tell them, friends, it doesn't happen that way. Number one, please understand, God made this body extremely beautiful. And this body gives you a good average. What I mean by that is, imagine a car, right? So my car is about 3 tons. In 1 liter, it can go about 7-8 kilometers, just 1 liter of petrol. So imagine the capacity of the car or how efficient the engine is. Similarly, this engine is extremely efficient. So putting into numbers, do you understand that even if you take just two Marie biscuits, just two biscuits, that is equivalent to running 3 kilometers? Yes. So let's say you go for a run in the morning, you ran for 3, 4, 5 kilometers, you come back, have a tea with 1 spoon of sugar and two Marie biscuits. It's all. You have put in the same amount of calories that you wanted to burn. So that's important. So burning calories is not always the answer. And now let's do some mathematics, right? Mathematically, if you want to lose 1 pound, 1 pound of weight, you need to burn close to about 3,300 kilocalories, right? So into kgs, 2.2, right? So approximately 7,800 kilocalories. So if you burn 7,800 kilocalories, you may lose 1 kg of weight. Now, similarly, if you want to do it just by exercise, and I understand that many of you could have gone on a treadmill. So if you are on a treadmill for an average individual, right? If you run at a speed or if you walk at a speed of about 8 kilometers per hour, the amount of kilocalories burned is about 250 approximately, right? It will be different for different people, for different individual, different for different incline, and so forth. I'm just taking an average. So in 10 hours, you would spend about 1,500, in 20, 5,000, and in 30, about 7,500, which is equal to 1 kg. So if you walk on a treadmill regularly for about 30 hours, you may lose 1 kg. And that's how this body is made. So when we say that I've been going to the gym regularly, I work out for 40 minutes, the amount of kilocalories spent is much, much less than what you need to do. So how you need to divide? So let's say you need X amount of weight loss. We divide it into 50 and 50. 50, you have to cut down from your food, and 50 you need to burn. And that's the correct way of doing it. It has to be slow. It has to be consistent effect. It cannot be that you go to the gym one day and the next day you would not do it. That's not right. You got to be on your toes. Self-discipline is to be done every day. Consistency. So consistency is the key. Going to the gym, going to the football field, going to the lawn tennis, or going for badminton once in a week, twice in a week, it really doesn't matter. You need to do it consistently, and that is the important part. And because it's consistently, you have to also keep a check what you put in your mouth. It's extremely important. You have to be aware that what you put in your mouth is going to give X amount of kilocalories, right? It is an extremely important thing to read the labels. More than half of these labels or the food labels have a mandate to give what all they contain. So if you read the labels well, you will understand how the food distribute the energy. They may say no sugar, or they may say no added sugar. That's true. They haven't added sugar, but they still have normal sugar. Like fruit juices, they say no added sugar, right? But they still have fruit sugar. Sugar is sugar, right? So you can fool yourself. I take this brand of juice which has no added sugar. That's false. It still has sugar. And I'm not saying sugar is bad for you. What I'm saying is excess of sugar is bad for you. And you can have healthier, rightful alternatives. So that is number one, right? Now, as I said, only exercise and only dieting may not all be easy. Now, I will take my example. If someone tells me that I need to get up at 7 o'clock every day, 8 o'clock, take this tea, 9 o'clock, do this, 10 o'clock, do this, 11 o'clock, do this, I may be able to do it for 1 day, 2 days, 3 days, 5 days, 10 days, a week, 2 weeks, 10 weeks, right? But that's not physically possible. And then you would say, but you were talking about consistency, you were talking about discipline, and now you're saying it's not possible. So there's a difference between what I said. What I'm trying to say here is it's important to have discipline, but it becomes difficult in our busy lives to be disciplined every hour. It becomes difficult. There would be situations when you're in an office, you're in a meeting, you're on a playground, you are at your kids' sports day, you are on your kids' college function, right? You are operating. You may not be able to follow the same strict regime. Thereby, just keeping a food diary may not always be possible. What we need to understand are the principles. And the principle is keep it simple, right? Number one, avoid condensed and high calorie food. Avoid processed food. Read the label and look at the fat and the calorie content. Avoid easy way out in terms of your food and ordering food, right? Now the fallacy is a bowl of salad, which is a healthy food, is about 400 bucks. But a burger, which is full of oil, bad carbs, bad fats, is 40 bucks, 50 bucks. A samosa, deep fried samosa, is 20 bucks. A bread pakoda is 10 bucks. So most of our food or the bad choices of food are cheaper. So it becomes difficult sometimes to be able to manage financially always the right thing. But there are healthier, rightful choices. Sprouts, easily available, curd, yogurt, some amount of dry fruits, some amount of broccoli, paneer. You can make paneer at home. Eggs, cheapest, rightful, clean, best source of proteins. So you have to eat healthy, and you have to see to it that you start eating healthy and start getting into a practice of eating healthy. And would you get an immediate result? No. Another problem is when you don't get results in spite of doing all this, you get disheartened. And you say, I've tried everything for 1 month, I've tried everything for 2 weeks, and it's not happening. So, consistency. And for patients or for people who have a BMI more than 30, 35, these are the people who should seriously think about other interventions. And I'm not saying surgery is meant for all, but yes, surgery can be the first choice for many of you people who have a BMI of more than 35 with associated comorbidities. What do I mean? So if you have a BMI is body mass index, and you can go to Google, you can go on my website, www.athlepeters.com. You can see a BMI calculator, put your weight, put your height, and calculate your BMI. So if your BMI is more than 30 with comorbidities like diabetes, hypertension, OSA, dyslipidemia, and so forth, or if your BMI is more than 35 without any of these, surgery may be the first choice for you. And I understand that surgery, thinking about surgery is like, surgery, oh no, I don't want to get surgery. I don't want to change my system, and it's an easy way out. I don't want to take the easy way out. And what will people say? What will people think? And I always tell them, right, guys, you're talking about your life here. You're not talking about what people are going to think about your life, right? You are responsible for your life. You should be knowing that you are the most important part of you, right? I ask my patients, right, tell me any 3 people, 4 people who are important in your life. So they will say, my husband, my daughter, my son, my mother. And I said, great, but where is you in this four? No, I'm also important, but you know what? I'm a wife and I have to take care of myself. No, that's wrong. Please understand. आप और आपका में दोनों में फर्क है. You must understand. पहले मैं फिर मेरा. If I don't exist, my things won't exist. To be able to cater to my family, to be able to cater to the needs of my family, including my parents, my wife, my kids, my patients, and so forth, I need to keep myself first, right? If I keep myself first, if I keep myself healthy, that is the time I should be able to keep and do my responsibilities rightfully. So it is extremely, extremely important to keep yourself first. And keeping yourself first means if you need an intervention, you do need it, right? Now, people do ask me, what are the interventions? I don't want to get a surgery done. And I tell them, right? These are defined modalities of treatment, right? For example, I need to travel 3 kilometers. Now, 3 kilometers, I can go walking, I can take a rickshaw, I can take an auto, I can take a cab, I can take my car, right? Now, if I want to travel 400, I still have a choice of taking my car, I have a train, I can take a flight. Now, if I have to travel across continents, can I walk? No, I can't. I can't. Well, theoretically, yes, but practically, can I walk? No, I can't. Can I take a rickshaw? No. Can I take a taxi? No. I will have to take an aircraft. Similarly, with different people, where different weight is involved and different type of targets, we will have different defined categories of intervention. So some people may benefit by just diet, exercise, behavioral therapy, and a good regime, right? A few people, we may add a few drugs, right, which can change and alter the hormonal imbalance. So drugs are only primarily for hormonal imbalance. And yeah, when I talk about drugs, I need to mention that we see a lot of influencers, we see a lot of people talking about the magical pills, the magical injections, and I see people lying blatantly about, I used to weigh so much, I've lost 30 kgs with this drug, and I've taken this injection once a week, and I have this magical drug. Please be informed, these drugs were not made for obesity, they were made for diabetes, right? In a very select few people, these drugs can be used with obesity and diabetes. But if you think that these drugs are magical drugs, please think again. Each of these drugs has serious side effects, can have serious side effects if it is not indicated. For that matter, all drugs, right? If a patient of a kidney failure takes NSAIDs, paracetamol, ibuprofen, his kidneys will fail. But if a patient who has a severe pain and needs to take an ibuprofen, he will feel relief. So each drug will have a different type of problem for different type of patients. So there are no magical drugs, my friends. Absolutely none. None. There are no magical pills. None. So when I said may add a few drugs or few medicines, what I mean to say, if you are having a hormonal imbalance, we may have to add. If you are a diabetic and obesity, we may add a different set of or some group of drugs which can help you both in diabetes control and some part of weight loss, but no magical drugs. The third is intragastric balloon. That means we can put a silicone balloon and we can do an intervention wherein the balloon stays in your tummy and you can lose some amount of fat, some amount of weight over a period of time. It is temporary. Most of the people will regain almost all the weight back once the balloon comes out. So there are two types of balloon. One is a swallowable balloon. One is a balloon that we insert by doing an endoscopy. So most of the people, when the balloon is out, which could be 3-4 months or after 1 year, they tend to regain all the weight back. So if you're looking for a very small amount of weight, your target is small, and you want something that you can which can boost up your morale, and you need a small 5, 7, 10, 15 kgs, 5%, 7% of your weight, then probably balloon can be an answer. Then comes surgery or bariatric surgery or weight loss surgery, which has stayed and stood the test of time for more than 50 years now, right? I've been doing it for more than 2.5 decades. For certain patients, this is the first choice. Now, please understand, bariatric surgery is not the last choice. It's not the easy way out, and it's not something that you are looking for an easy way out, so I don't want to do it. And what will people think? I got a surgery for weight. You are not answerable to people. You are answerable to yourself. You are answerable to yourself for having a good health, right? So please don't get into the situation wherein you think, what will people think? I'm looking for an easy way out. No, it's not an easy way out. Surgery is not an easy way out. Absolutely not. Post-surgery, you need to have a disciplined life. You need to have behavioral changes. You need to have a good strict diet. You need to take multivitamins, proteins, right? You need to do all that to have the maximum effect of surgery. Surgery is not you come in, get your surgery, and the next day you start losing weight, and then you can do whatever. No, that's not true. Surgery needs a lot of discipline, a lot of self-discipline, a lot of time for your own self, and you need to be with a surgeon, right? With your dietitian who will counsel you how to take rightful weight, how to take rightful diet, and it's important. And so people think that surgery or bariatric surgery is a cosmetic procedure. No, it is not. Bariatric surgery is a life-changing surgery. If obesity is a disease, bariatric surgery is a solution to that disease. It is not cosmetic. It is not to make you thin. It is not aimed to make you look beautiful. Would you look beautiful? Yes. Would you become thin? Yes. That's a side effect. Or that's, I would say, a side effect, that's an added effect. But the whole logic of doing bariatric surgery is to give you a good health, a longer life, a disease-free life, and a good quality of life. So the idea of surgery is to give you disease-free, good quality of life. You will lose weight, you will look better, yes. Will the pigmentation go? Yes. What will happen to the associated comorbidities? So patient comes and say, sir, I'm a diabetic, how can I get a surgery done? Okay, this surgery is made for diabetics, right? So law of circle is for all circles. Similarly, this surgery is made for diabetics. So the patient that I operate would be diabetic, right? So this surgery is made for diabetic. Some people say, sir, I use an OSM machine. I use a CPAP and a BiPAP. I can't live without it. Will I survive the surgery? That's okay. It's perfectly okay. This surgery is made for people suffering from OSM, obesity, right? So it becomes important. Yeah, it is important for you to understand that this surgery is something, first, not an easy way out. Secondly, it is not meant for everyone. But yes, for certain subgroup of patients, this would be the first choice, right? It is safe, it is secure. Gone are those days when people used to say, you know what, in surgery, 2 weeks of bed rest and blah, 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 blah. All my patients, I would say 80% of my patients are back home the first or second day. They can drive back home. No incisions. In terms, there are no scars. There are no scars, right? There are no bandages. There are no drains. There are no pipes. They can walk. They can, in 3 hours, they should be walking away to the washroom themselves. So it's easy. Anesthesia has changed. Anesthesia has become very safe. Surgery has become safe. the ICU intensives have become safe. And because it is done in a tertiary care center, we have a group of people who will be taking care of you in terms that they will be taking care of you post-operatively in the best possible way. And okay, so having said that, I think I will start taking questions. It says, uh, 28-year-old, and I have type 2 diabetes for the past 5 years. I'm really been insulin as in surgical medical intervention. Yes, that is true. So we should understand that this surgery is done for three subgroup of patients. Number one, obese people. So people who are obese, they can do the surgery for them and they can lose weight and get rid of obesity and related other diseases. Second, people who are obese and diabetes. So patients who have obesity and diabetes, this surgery will benefit you both for obesity and diabetes. This is the second subgroup. The third subgroup of patients are patients who have type 2 diabetes. Now that surgery is called metabolic surgery for diabetes. It's slightly different from bariatric surgery or weight loss surgery because it is done primarily for patients who are not really obese, but diabetes with type 2 diabetes. We're not talking about type 1 diabetes. We can't do surgery for type 1 diabetes unless they are super obese. So we do surgery for type 1 if they're obese, but in type 2, we can do surgery for obese and non-obese people. We have excellent results for patients undergoing metabolic surgery for diabetes. We have seen patients on insulin leaving their insulin. So the question is, how would it affect me? So I tell all my patients, it will have a positive impact on you. So 100% patients will have a positive impact. Now, out of this 100 patients, about 50 to 70% patient will be the patients who would get almost a total remission. That means you are on no drugs, you are on no insulin, you are on nothing, and without anything, your HbA1c is still in a non-diabetic range. These are about 60-70% patients. Another 15-20% patients are people who are taking insulin and taking 5 drugs and still have uncontrolled sugar. So these patients maybe that the insulin will stop, maybe they will still need oral medication, but their HbA1c will become better. So we are doing it to save their end organs. That means your eyes, your heart, your kidneys, your legs. Largest cause of blindness in the world, diabetes. Largest cause of heart failures and kidney failures, diabetes. Largest cause of amputation in the world, that was cutting your limbs, diabetes. So diabetes itself is a killer. So if this surgery or metabolic surgery for diabetes can give you some relief in terms of saving your end organs, yes, it will still give you some benefit. All patients will get rid of insulin? No. Most of them, yes. Some of them will still need some medication, but they will have a better control of the diabetes. Now, the next question is, what is your opinion about the new obesity drug like semaglutide? So I shared this. So semaglutide primarily is not an anti-obesity drug. Please understand. It has been cleared by US FDA for diabetes, not for obesity. So number one, this is a false belief that semaglutide is an anti-obesity drug. No, it is not. It is primarily meant for type 2 diabetes. So don't get fooled by people taking it. Don't get fooled by a lot of influencers talking about it. Don't get fooled by other GLP-1 analogs where people say, "Yet we've been taking this, we've been taking this." If I show you the harmful effect and how many people are suffering because of these drugs and taking over the counter without any cross checking, without any real prescriptions, you will be surprised. So, no, it is not an anti obesity drug, it is a diabetic drug. It has not been cleared for anti obesity. There are other drugs which have been cleared, yet they have to be taken under supervision in special circumstances. These are not magical drugs. Please don't go there. Please don't buy them. I understand it is not available over the counter in India, but in a few countries it is available over the counter. And I would not want to name a few. I've seen a lot of people importing it, smuggling it, getting it done. Please don't get into this. These drugs are to be taken under supervision. So there is another one that my husband and both pray about this thing, and after marriage, our love bonding remain food leading to continuous intimacy, overall health. We feel stuck in a cycle of procrastination. Can you guide us how break this pattern again? Both have an emotional reason we love. So, dear Jay, I'm not naming you deliberately, and what I would say is with a weight of about 150 kgs And with both of you weighing, yes, it is an important problem. And for you guys, surgery is the only answer, and it should be the first option for you guys, because it will bring you back uh, your health, your quality of life. And quality of life, I would mean not just the quality of life medically, but also physically. It will give you a better relationship between the two of you. You could probably live better, breathe better, sleep better, play better, have a better physical relationship between both of you, and plan even in future in terms, if you want to plan your family in terms of your kids and everything. So for this type of weight, I would suggest bariatric surgery is the answer. And of course, by the end of it, I will give you a number where you can get in touch with us, and we would be happy to answer all your questions that you have. And T says, I've tried gym workouts, multiple diets, but every time I lose weight, it comes back. Feels like a never ending cycle. So T, I understand what you're saying, and this is the typical yo-yo effect that we see, and that is the reason that I say that it is not always what you eat and the exercise. The hormones are that we have, the hormonal milieu that we have, is made like that, and we must also understand. Here, I would like to give you and go back and give you a simple. A simple story I can say that in prehistoric time humans had to hunt for their food, right? And so food was scarce and exercise was excessive. That means prehistoric man has to go hunt for food, hunt, and people who could store food had a survival benefit, right? So there are certain genes called thrifty genes which, if expressed more, could store more, and they had a survival benefit. Similarly, today also all of us have these genes. Some of us express more, some less. And another hormone called ghrelin, which is also called the hunger hormone. That's how the body plays. When we lose our weight, about 11 to 13% by dieting, this hormone, also called the hunger hormone, increases in our body because the body will try to conserve that fat. And when that increases, it will force us to eat, right? And then when we eat, we will always overshoot what we did. So this is how the body is made. The body is made to conserve energy. We will have to fight it out. It's a everyday fight. And then comes the first thing that I said: consistency is the role, right? Consistency is the key. You'll have to do it day in, day out for years together. Rome was not built in one day. People come and ask me, "Sir, you're very muscular. Tell us something that I want to be like this in 6 months," but it's not going to happen. It's not going to happen, right? Consistency is the key. You need to be disciplined every time, all the time, right? So gym is good, exercise is good. Please continue what you're doing. Take a watch, see what you eat, take a weighing scale, put it in your bathroom, weigh yourself first of each month, write it down, write it down, and see how you work, right? Now, will my relationship change after surgery? I'm scared how people will treat me. Are you really worried about people? Should you not be loving yourself first? Why are you so concerned about how will people think? Why should you be worried about people? Tell those people that you've got a kidney failure, right? And you need a kidney. Let me see how many of those people will come and help you out donating. How many people will actually even donate with brain dead people? How many people or relatives actually come for organ donation? None, right? Please don't think about the world. World doesn't want you to be happy. World is there to put you down. You are responsible for yourself. You are responsible to make yourself look good, to feel good, and you are one who should be seeing yourself as more important than having what will people have think about me. Why do you think about the opinion of other people? It's not important. What is important is how you live. So stop worrying about people. Secondly, if you don't want to tell, it's your choice. If you don't want to declare it to people, it's your choice, right? You don't want people to not know, right? But I always say, if you get surgery, it's okay to tell. But if you don't wish to tell, it's your choice. You don't have to. You don't have to. They will never know. But stop thinking about what will people think. People are there to put you down. You are responsible for your life, for your family life. So please be selfish about yourself. It's like if you give an exam and if you study for 9 hours, what will people think? You study for 9 hours. Are you worried about what people will think, or are you worried about your own self? you should be worried about your own self. You are important. You are God's child. Please understand, this is the temple of God. God resides within us. So you should be responsible about your own self, about your own body, your own health, and your own quality of life. Right. So, what are the other questions? The other question is, does insurance cover bariatric surgery? Yes, it does. Not in all cases, but most of the cases it would. We really had to fight it out, and till about 3.5, 4 years back, it was not covered. But now most of the insurances will cover, and so yeah, it does cover. Not all good insurances will cover. Almost all corporate insurance will cover, and you should fit into the criteria where. So it's not meant for all. So it's not if you just want to lose 10 kgs, will insurance cover it? No. If you fall in the category, these are defined categories, right? So if you fall into the categories, insurance should be covering your maybe it will cover 80%, maybe it will cover 100% depending on the types of insurance that you have and the different types of insurance policies that we have. And but yeah, it does cover. And of lately we've seen a lot of refusal from the insurance companies, and insurance companies are playing games with patients, and I'm slightly upset with that too. And but yeah, you should fight for your right. And when a defined surgeon or when a bariatric surgeon or if your surgeon says that you need it and you are categorized into the category wherein you are going to benefit out of bariatric surgery, the insurance should have a mandate to pay. Of course, you should have. They usually have a lag period of about 3 to 4 years before they start paying it. But yeah, they are paying for bariatric surgery. Okay. So now the after surgery, when can I resume work? Third day. So you can resume your work from the third day. If you're doing an office work, probably the second day. Third day, if you're going to the office, you can drive the car, you can resume work. And as I said, there is no real bed rest. And I don't want you to do bed rest because there is no bed rest required. Yes, you are on a specific diet. What we follow is a principle of two, and it's a very simple, easy principle. For the first 2 days, is the clear liquid diet. That is clear means anything that you can see through: coconut water, apple juice, clear soups. For the first 2 weeks, you're on a liquid diet. For the next 2 weeks, you're on a pureed or a blended-rice diet. In the next 2 weeks, you get to a normal diet. So you can carry your liquids, you can carry small thermos, you can carry your charge, you can carry your coconut water, you can carry your soups, chicken soups, vegetable soups, tomato soups, spinach soups, and so forth. And you can carry your protein powder, you can carry protein shakes, and you can do your normal activity. And within the first 2 weeks, you can start your normal physical activity in terms of going for a walk, morning walk, early a jog for a few kilometers. Then after 1 month, you can start your light exercises, and after 2 months, you can start even weight training and your heavy weight training and everything. So you can start your work as early as second, third day. How soon can one conceive after bariatric surgery? So the answer would be, technically speaking, bookish knowledge or bookish recommendation is about 18 months. But what I say is at least for 1 year, patients should wait, because in this 1 year, there are a lot of hormonal changes, there are a lot of physical changes which are happening inside the body, and pregnancy is a high demand. So when you are pregnant, you have to not only take care of yourself but the developing fetus, and you need to take a lot of more proteins and vitamins and minerals and so forth so that the fetus can grow well. So first 1 year, we don't recommend anyone to get pregnant, and ideally it's 18 months. But after one year, one can plan their pregnancy. And but at the same time, when you plan a pregnancy, please go back to your pediatric surgeon and tell them that you're pregnant, because sometimes your obstetrician may not be very well aware of the obesity surgery. You may hide it from your obstetrician sometimes, which is not a good idea. You must always declare it that you've had a surgery. So be attached to both your obstetrician and your bariatric surgeon, so that you know that they're both taking good care of you and you are taking good care of your fetus. So minimum 1 year should be paid. Any chances of weight regain after bariatric? Of course, yes. So it's like saying I can teach you how to drive. You can drive well, but if you start drinking and driving, or be on your mobile and drive, you can meet with an accident, right? So people can fail this surgery, right? It is not the surgery which fails, it is people or patients who fail this surgery. Now, how do they fail? Number one, complacence. They get used to a good life. Second, not changing their bad set of friends. And no, I know I chose the word bad set of friends. And I'm not saying friends are bad, but people who will put you down, right? Or people who will get you back in the same bad habits that you were in when you were obese or when you were gaining weight. Please change those set of friends, right? Getting into alcoholism, right? So that's another big problem. So if you are not careful about life after bariatric surgery, and that's the reason why, at least in our unit, in our program, we follow all our patients for 10 years. Yes, 10 years. You need to be with us for 10 years. And it's not that we're going to be doing something very massive with you. We're just going to be guiding you to live this surgery. You live this surgery the rightful way, and you're going to have fantastic results. Weight regain is primarily because of people getting indisciplined, not following with their nutritionist, not following with the bariatric surgeon, not taking good supplementation, getting back into bad habits, especially alcohol. Skin loosening after surgery and solution for it. So, skin, somewhat of loosening can happen. So, if I tell you that you are not going to lose any, the skin is not going to be loose, that's a false statement. Young people, the elasticity of the skin is better. In older people, the elasticity is slightly bad. So, they may have uh, difficulty in gaining all the elasticity of the skin. But young people, the elasticity is good, so they will get back to their original size. Number one. So how I explain it is elasticity or returning back to the normal skin is inversely proportional to the length of the stretch and the amount of stretch. That means, so if you've been obese or if you've been stretching your skin for a longer time and you've had a lot of weight, then this skin going back to normal is difficult. Then, when you've taken an adequate amount of step and when you've taken your surgery at the right time, when it has not been going for a very long time and it is not really stretched to a 200, 300, 400 kgs, then the chances of skin going back is easy. We can use certain massage oils, we can do certain exercises, but some amount of skin loosening would be there. And if it is excessive, we also have plastic procedures where we can remove those extra skin and we can give you back the best shape that you want. So those are cosmetic procedures. We have those available and we can give you a nice cosmetic surgery after bariatric if required. Would everyone need it? No. Would everyone get it? No. People who need it, people who want it, it's available and can be done with excellent results. Does male infertility improve after? Of course, yes. One of the largest cause of infertility in males and females, both, is obesity, right? And in females, it causes an ovulatory cycles. That means they may have cycles, but the ova is not produced, or the ova which is produced is of not good quality, or fertilization is a problem. So fertility in females, which can be multifold in terms of production of the ova, to cycles, to fertilization, to conceiving, to implantation of the embryo, is all deranged. So it causes a lot of infertility in females. Similarly, in males, it can cause oligospermia, azoospermia. That means the quality of the sperm and the number of the count of the sperm both will go down, right? So quality in terms, you may have the same good number, but they could be deformed or amotile or dysmotile sperms. So they do not function well, or they could be dead sperms. So in males, infertility is a very, very important thing in obesity. So once obesity increases, the fertility increases many folds. And especially if you see, if one of the partners is obese, the likelihood of the other partner being obese is going to be there. So when both the partners are obese, then of course the infertility from the male factor and the female factor can combine to have a much larger effect. And then it becomes extremely difficult to have infertility, and the fertility issues are important. What about hair fall after surgery? So we must understand that hair fall or hair is not taken by the body as an important appendage, right? That means for body, hair is not important. It's important, but it's not vital to live. So post surgery, if you're not taking adequate amount of proteins, adequate amount of vitamins and minerals, the first thing that the body will do is to shut down the nutrients which are going to the hair because it's not vital. The body doesn't take hair as vital. So if you are not taking adequate suggested amount of vitamins and proteins and minerals post surgery, you can have hair fall. Most of the patients would not have hair fall if they take adequate amount of proteins, vitamins, iron, minerals, and micronutrients. So to prevent hair fall, please listen to your nutritionist. Please go back to your surgeon. Take all the supplements which have been advised to you, and then you can save yourself from hair fall. The problem is hair also goes in a cycle, right? It has a resting phase and a growing phase and a growth phase. So if you think that you got in a surgery, you've been suggested proteins or vitamins, you don't take it, your fall starts. And now you say, oh my God, I will take it from now. Now, just because you start now, the hair is not going to stop falling and it's not going to not go into that cycle. Hair is still going to go into that cycle. So the importance is, please take your supplements continuously. Because if you stop it in between, energy and the nutrition to the hair goes off. It goes into a cycle, a resting phase, and it will follow the same cycle even if when you start taking supplementation. So please take your supplements regularly in time so that your skin is better, your hair fall doesn't happen, your taste is better, and of course to keep your muscle mass up. The whole logic of this bariatric surgery or weight loss for whichever means we use is to lose fat, not to lose muscle. So I see a lot of people going into liquid diet, intermittent fasting, and what do you lose? You lose body water. What is the second thing to lose? Muscles. So, which is so foolish. What do you want to lose? The fat. What you want to regain? Body water and muscles. So, when you do intermittent fasting, when you go on fat diets, when you go with this fancy diet, which is, some chana, some this, some this, some this, and you don't take 1 gram per kg of your body weight of proteins, what do you lose? Body water. What do you lose second? Muscles, because muscles die. And what muscles are your furnace? So you go into that very bad vicious cycle. And I've seen so many patients getting into the cycle. What happens? You want weight loss, you go to some dietitian, you go to some weight loss specialist, so-called weight loss specialist, and mind you, I've seen a few of influencers. My patients, operated patients, who are still working as influencers saying that they followed this diet and that's how they lost weight. Which is sad, but that's how the world is. Don't get into this of just listening to people, right? Please be scientific in your approach. Go to someone who talks science to you, right? So now understand this logic. You want to lose weight, right? You start dieting. You don't take adequate proteins. You take only fluids. You don't eat after 5 o'clock, 6 o'clock, 7 o'clock. You eat only veggies. You eat only salads. You don't take no proteins. So what is going to happen? Your fat is going to stay there. You're going to start losing muscle mass. Yes, you're losing weight. You are, because body water will go and muscle mass will go. So if you do your body composition, what you will realize is your muscle mass is gone. Now what is happening? Now after a while, the body will start to conserve more energy, right? And what will happen? You will have more fat. So once you do your composition, and again you will see that you've lost weight, but your percentage fat has increased, your muscle percentage has decreased, and you needed more muscles to be more healthy, to do more physical work. Now you start feeling weak. You can't do more work. Why? Because your muscles are less, right? And muscles are the furnace. Muscles are the big factory, are the big furnace to burn your fat. So if your muscles are less, your BMR is going to come less. So you're going to burn less and less calorie at rest. So you're burning less, your muscle mass goes down, and you become weak. So you go into that bad vicious cycle of losing what you wanted and 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 gaining what you wanted to lose. So don't get into these bad habits of doing wrongful intermittent fasting, wrongful food, fad diets, listening to people without any scientific basis. Don't go and don't listen to people just because they can show the pictures of before and after. Don't do that, right? Please understand that there's a scientific principle. There is a proper scientific way of losing weight, and follow that principle. So there are no real age limits. The question is, what is the age limit? There is no real age limit for the surgery. The prescribed age is anything after your late teens, which is after about 16 to 18, till about 60 to 70 age. And in certain subgroup of people, certain specific patients, we can go lower in that age group. The youngest that I've operated is about 8 years. That was a different condition altogether. And I'm not saying all people with less than 18 should be operated. No, we should be investigated. Ideal age is for more than 60 to 80 till about 60. We've operated people with 70, 75, 82 in rightful conditions in rightful patients. So each patient has to be worked up, has to be seen whether that's the right approach to them or not. It's not a blanket cover, number one. Second, it's not one surgery made for all. It's not like small, medium, large. You go with sleeve, you go with bypass, you go with this. No. Each surgery has to be carefully thought of. Each procedure has to be carefully thought of. Each procedure should be done as per the requirement of the patient because each of you is different. Your requirement is different. A young lady weighing 120 kgs needs to have pregnancy who has no diabetes. Another patient of 120 kgs who has diabetes and taking insulin. Yet another 70-year-old patient who has a kidney disease weighing 120 kgs. All three of them, though all of them weigh 120 kgs, will have different requirements. So they will have different types of surgeries because the outcome will be different. So it's not one size fits all, different types of surgeries, different types of outcomes. But the most important thing which I can never reinforce enough is follow up after bariatric surgery, behavioral changes, dietful and mindful eating, which are so damn important. Yes, we have support groups, and earlier we were having support groups every month, but off lately because of some amount of construction happening at the hospital, we are not been able to hold the support groups that regularly. We have it every 3 months, but yes, once our auditorium and everything is made, I think our support groups will be resume in about 3 4 months time. We should be able to have regularly the way we were having earlier. And these support groups are important because you tend and you meet people who undergone surgery. You can mix and match and you can meet people and you can listen to their success stories and you can learn from them. They can learn from you. So this is important. We of course have a Facebook group where everyone can interact with each other. We also have only ladies group wherein the ladies and the young kids can interact with each other. And the men would think, why ladies only group? The logic being that some of these young ladies would not want to talk about their weight loss journey. Some of these ladies, especially in Indian subcontinent, would not want to declare their surgery. So that's the reason why we made this group where these young girls who would not want to declare the surgery but yet would want to listen to other people and listen to their stories and adapt from their changes that they've done after the surgery. They can talk to each other and they can do some amount of chit chat in between. And Dr. Bina is still there, and Dr. Bina would coordinate between them and she would take care of them all the time. And we can take a few more questions. And one of the question is, how has it become more safer? So it's become safer, as I mentioned earlier. It's become safer in terms of the surgery, the surgical staplers that we use, the instrumentation that we use, the anesthesia that we use, the table that we use, and now with the advent of robotic surgery, it's become much more safer, much more cleaner, easier, simpler, quicker, less painful for the patients. And what used to take 2 hours, 3 hours earlier for surgery now takes 10 minutes, 15 minutes, 20 minutes, 30 minutes for a surgery. The patient quickly get back to work. They can drive the car back the next day home. There are no bandages. We use glues. They can take a shower the next day. They can work in terms of work from work, or if they have work from home, they can do it from the next day or within 1 or 2 days. They can do their activities in terms of walking upstairs, downstairs, doing the normal household work. Ladies or people or housewives, they can resume their work in terms of taking care of their kitchen, taking care of their husbands, and normal cooking, washing, cleaning the house, everything can be done within 1 or 2 days. So it's really changed. And as I said, I started almost 2.5 decades back, and the surgery that time and the surgery today has changed. The use of staplers has become good. The choice of staplers are very good, and this has become safe. From a leak rate, which used to be almost 2, 3, 4% earlier, it has come down to less than 0.1%. The morbidity, the drains, the other leak rates, the bleed rates have really come down drastically. So this surgery is safe, and we can do not just a safe surgery, but it also gives. Uh, it is also important to understand that it's safe and it can give you a good result, and result not in terms of how you look, but how you feel in terms of being disease free and a good quality of life. And I think this is my last question that I will take. It says, is there any drug advice for killing your hunger? So no, I would not advise anyone to take any drug to kill your hunger. I think it's self-discipline. It's like, you know what? Yesterday I was seeing this very funny thing. There was this a box in which you could keep your phone and lock it, so that after 10 o'clock you don't open the box, and it locks, and it will open only the next day. And I was surprised that people actually need the lock to keep your phone in that lock, so that you are not, tempted to go and use your phone. So for some people this may work, and I'm not making a mockery that people can't do self-discipline. Some people can do self-discipline, and some people need some help. It's perfectly okay to need help. I think instead of using drugs, keep a bell, and keep some amount of reminders on your phone. And if you're hungry, it's not always not to eat. What to eat is more important than what not to eat. So if you're hungry, don't curb your hunger. Eat healthy, eat rightful food. And if you eat rightful food, protein, that will take care of your hunger and also not give you obesity. So killing your hunger is not the right thing, but taming your hunger is more important, right? So my advice is tame your hunger so you eat right food at the right time, right? Sometimes once in a while you want to cheat, it's okay, but let that once in a while be just once in a while. And if you think that once in a while will become more often, then don't do it once in a while too. Rightful eating, mindful eating. That's the key to success. So, what is more safe, robotic or laparoscopic? Both are extremely safe. For certain people, robotic may be advantageous, especially if you're doing a redo surgery. And if it's a super obese, like a 200, 300, 400 kg patient, robotic may give you better assistance. But laparoscopic or robotic, both in terms of a bariatric surgery, both are equally safe, both are equally doable, both are equally good. So, with that, I think we will come to an end of our live session. Thank you so much for joining in, and I hope that I was able to give you some insights about obesity, why obesity is a disease, how obesity is linked to other diseases, how diabetes, dyslipidemia, hypertension, heart diseases, kidney diseases are linked to obesity, and how obesity should be tackled not just in the hospital but at home. How you can take care of eating mindful, eating rightful is important. How exercise or is important, and it's also important to take care of yourself. Don't think too much about what people will say. Don't think surgery is a shortcut. Don't think surgery is the last option. Don't think that drugs are magical drugs. Don't think that there are magical injections available which will make you think. So nothing is easy in life. Discipline is the key, consistency is the key, and keeping yourself first is extremely important if you want to really gain good health, good life. Take care, have a nice day, have a nice week ahead. And if you still have any questions, and if you think that I have missed something, and if you think that uh, I would have added something more, I'll be very happy to answer all your questions. And any advice for those who have already undergone bariatric surgery? Yes, please stick to your surgeon, please stick to your nutritionist. Please don't think just because you've had surgery, you've had results, you will not rebound, you're doing well, and everything is just perfect. Please follow up diligently. It's extremely important for you to follow up with your surgeon, follow up with a dietitian and a nutritionist to have a long-term effect and keep obesity out of your life. Okay, guys, that's it. I am Dr. Atul Peters, and I am the Senior Director, Pediatric Minimal Access and metabolic surgery at Max Smart Super Speciality Hospital, Sake. I hope I was able to give you certain insights about obesity and how obesity is a disease and how we can all collectively fight. I'm happy that our respected Prime Minister is taking care and is now initiating a lot of movement about obesity. And I hope this movement continues in our lives. And I hope we all reach to this conclusion that obesity is a disease which we need to spare awareness amongst ourselves so that we can nip this killer in the bud. Take care. Bye bye.